My name is Alice Mills. I was born and raised in Baltimore. My husband was retired from the military. I have 5 daughters and 7 grandchildren and 9 great-grandchildren and 11 great-great-grandchildren. You're in my own home, a senior building for those 62 and above. It's a small, nice little apartment, and I love it. I feel very comfortable. Been here for 22 years. And most of the people in here, it's like a family. We really look out for each other. Each one of us decorate our front doors. It tells a little bit about it. It's been a real blessing to live here.
When you've had a traumatic experience, like a stroke, for her, the trauma of that, and then to remove her from home, the place that is familiar, from a place of comfort, I think that's a huge battle.
We provide advanced level medical care in the home. Alice unfortunately had a stroke, which means that she's got impaired mobilization, which becomes a problem with skin integrity, possible pneumonia, possible blood clot, or pulmonary embolism in her lungs from inactivity. So we're here to get her up and going as safely as we possibly can and teach her a new heart-healthy diet.
When somebody has a devastating illness or injury, it's my job to come in and look at how they're functioning in their home environment and see what can I do to make this person safer. Sometimes that means we order them equipment and teach them how to use it. Sometimes it's more focused on a restorative type therapy. Like Miss Alice, I'm really focusing on helping her to recover the function of her left arm after her stroke.
Home care consists of a variety of needs. We typically see 6 to 7 patients a day. We have different kinds of visits.
Mrs. Alice is a wonderful woman. Prior to this stroke, she was driving, she was doing her own grocery shopping, completely independent. So she had had a very steep decline from her normal level of function.
Just being able to have that one-on-one time with the patient for nurses, that's a big deal. It's just also rewarding to build that trusting relationship with your patients and families so that we can try to make sure that you are not going to the hospital unnecessarily when there's an intervention that we can do in the home.
People come out of rehabs and they are defeated. A lot of patients I worked with in skilled nursing, they told me, I just want to get home. That's everyone's goal. Their goal is to get home, to be home.
From our family's perspective, we have seen the motivation within our mother to be able to be at home as the #1 driving force in her recovery. It is what she has said every day, I want to remain home, and so I'll do whatever the work is.
Even sleeping in their own bed makes a huge difference, and some of them aren't sleeping at night, be it in a hospital or a nursing home, anything that snowballs into not doing well physically and emotionally. In my view, if Medicare wants to control costs, save money, they will do everything in their power to keep people in their homes.
If patients don't have access to home health and they are relying on the hospital or into acute care settings where there are increased costs for the Medicare population. So if patients don't have access to home health, the Medicare benefit is going to have to pay out more money.
It is such a privilege to be able to take care of them and establish a bond with them. They really trust you.
My sisters and I, our entire family, we are so thankful that this care is available. It does our hearts good to know that she can receive this type of care. I'm so thankful for that.
Here at home, I'm comfortable. I'm home, and I love it. And this is where I want to be more than anything in this world. This is where I feel motivated to get better and to do more and to learn more. And these people that are coming here to help me, they've taught me all those things and helped me to learn how to do that in my own home.